Hi there. My name is Jason Hogan. I'm an emergency medicine physician at Gunnison Valley Health. I've been heavily involved with our incident command response to this pandemic within the Gunnison Valley. I wanted to take a little bit of time today to help hopefully provide a little clarity to where we've been over the past month and a half in fighting this virus, as well as where we hope to be in the coming weeks to months. First of all, I'd like to thank all of you within the community for the tremendous effort, time, energy, and sacrifice that we've noticed in our response to this virus. I do also want to recognize the huge impact on families emotionally who have certainly been more closely affected by this, and also want to recognize the individuals that we've lost within our community as a result of this virus, and the families that are continuing to make very difficult decisions each day still. But overall, through the tremendous efforts of the community, I think we have to recognize that many, many lives have been saved by our efforts to flatten the curve within the valley. At the same time, there are significant economic, mental, and societal impacts to the ongoing public health measures that have been put in place to protect the safety of the lives of our community, especially those at risk within our community. And we have to try and balance that safety and the health and wellness of our community with the ongoing economic impacts. I want to thank the early response to this virus and those efforts to help save lives. And I could spend all day trying to thank people within the community, but certainly Crested Butte and Gunnison Fire and EMS, the volunteers at the call center, volunteers at the screening site, the efforts of our frontline healthcare workers, and the entire Gunnison Valley Health and our broader healthcare community who have put in countless hours and certainly sacrificed their own health to an extent to help protect those within our community. And then the broader response within the Emergency Operations Center, our Incident Command Response, and our public health partners. As we recognize that we've effectively flattened our curve within the community, we now have to determine how to best move forward and again safely try and look towards relaxing these measures that are in place. And one concept I think that has helped me wrap my mind around how we're going to proceed going forward is trying to learn to live with COVID, which is more of a concept on what our new reality might be in the coming weeks to months. So in my mind, I do see a lot of the existing social distancing efforts that we're all trying to do as individuals. I do see those in place in the coming weeks to months. Whether it's wearing a mask, whether it's being extra mindful about washing your hands, and whether it's being extra mindful about how closely you're associating with individuals around you. And it's going to be certainly a challenge, but I think also an opportunity for both individuals, but also organizations, businesses, groups going forward about how they can best participate in the ongoing effort to keep the curve flat while hopefully trying to create some sense of progressive normalcy within our society. Part of what we're looking at as an effort to keep the curve flat is how do we monitor effectively for new infections. Right now, as all of you are aware, we've been extremely limited by testing, and we still have certain delays that have to happen just based on the limited testing capacity within the Gunnison Valley, within the state of Colorado, and more broadly nationally. This is not a unique problem to our community. But we're hoping that through our efforts that we're going to be able to acquire more rapid, widely available testing within our hospital that will then be more broadly available to members of the community. And that's just rapid, quick testing that we can try and get an idea of whether someone has an active or new infection. At the same time, we're hoping to have more testing available as well to establish whether someone might have active immunity against this virus. So many of you may have already read about the IgG testing, and we're working as well to try and make sure that we have that available to first our healthcare workers and our more essential business staff within the community, but then hopefully more broadly to get a better idea of what our immunity is within the community. And we're still hoping to have more, ability to interpret that information as well as we acquire it. So I can't stress enough about ways that you as an individual can help us continue to keep the curve flat and allow us to, again, develop ways that we can learn to live with COVID within our new normal. And part of that is, again, some of the simple things that we've been talking about since the beginning. So washing your hands effectively, making sure that you're disinfecting higher risk or more exposed surfaces, wearing a mask or trying to cover your mouth if you're coughing, and then try and continue to follow some of those basic social distancing measures that we've all been made aware of, and then certainly continuing to follow the direction and guidance of our public health officials. So I hope that provides a little bit of clarity to you. We're going to try and give as many ongoing updates as we can as this progresses. And again, I want to continue to express my ongoing appreciation for everyone's efforts within the community and certainly the sacrifice that everyone's making through these efforts. I want to say that I'm extremely thankful for small things and small efforts that I think go a long way, one of which is when I'm driving to a night shift. It's helpful and inspiring to me to see hearts within the windows, knowing that we have the support of the members in our community. Please continue to stay home for us, and we'll continue to stay here for you. Thank you all.